All right, today we're putting on our detective hats. We're about to dive into a really common medical mystery, one that mostly shows up in older adults. Sudden, totally unexplained internal bleeding. So let's get right into the investigation.
So this is the big question, right? For doctors, for patients, for everyone involved. It's a genuinely scary situation, and you've got to find the source, fast. This is the starting point for our entire case today. And you know what? By the end of this, we're going to have it solved.
You know, every good mystery kicks off by identifying a suspect, and in our case, the culprit has a very specific, very medical-sounding name. It's time we put a face to that name.
And there you have it. The official name on the file is Angiodysplasia. Now, I know it sounds super complex, but what are we really talking about? At its heart, it's a deformity of the blood vessels. Just think of it like faulty plumbing in the walls of your gut that are just, really prone to springing a leak.
Okay, so let's build out a full profile on our suspect, just like the detectives would. First off, these aren't your normal tough blood vessels. We're talking about abnormal, super fragile ones. They're a major cause of not just big, obvious bleeding, but also those slow, sneaky leaks that lead to anemia. And who does this affect most? Well, it's primarily seen in older folks. And here's a fascinating twist. There's this interesting, though still kind of debated, connection to a heart valve condition called aortic stenosis. The plot thickens.
All right, we've identified our main suspect. Now, like any good investigator, we need to start looking for the clues it leaves behind at the scene. How does this thing, angiodysplasia, actually make its presence known? Well, the most obvious clue, the real smoking gun, is gastrointestinal bleeding. This is the big one that sends a patient to the doctor. But here's the cool part. The way this bleeding shows up tells a story all on its own.
And just like a clue at a crime scene, the type of bleeding helps doctors zero in on the location. Think about it. If the bleed is coming from higher up, say the stomach, that blood gets digested on its way out. The result? Dark, kind of terry-looking stools, which doctors call melena. But if you see fresh, bright red blood, that's a huge clue that the source is way down in the lower GI tract, like the colon, much closer to the exit. The clue itself points to where the problem is.
But dramatic bleeding isn't the only clue. Nope. There's a second, much quieter sign to look for. Sometimes, the angiodysplasia only leaks a tiny bit of blood over a long, long time. This slow, chronic loss leads to iron deficiency anemia, and that can make you feel tired and weak. It's a silent clue that something just isn't right on the inside.
So, with all these clues pointing a giant finger at our suspect, it's time for the formal investigation. Doctors need to get definitive proof to confirm the diagnosis and, crucially, pinpoint the exact location of those faulty vessels.
So here's what's in the investigator's toolkit. The gold standard really is a colonoscopy. It's exactly what you see here, a camera that lets doctors literally see inside the colon and spot those abnormal vessels with their own eyes. Now, for more serious active bleeding, they might pull out a different tool called mesenteric angiography. It's a special kind of scan that basically lights up the exact vessel that's leaking. Pretty amazing.
Okay, the culprit is identified, the evidence is confirmed, but a case isn't really closed until we have a resolution, right? So let's turn the page to the management playbook and see exactly how this situation gets handled.
In any active case, there is one non-negotiable first step. Before anything else, priority number one is to stop the bleeding. This is the emergency phase of the whole operation.
And there's a very clear step-by-step plan for this. The first line of defense is what's called endoscopic therapy. So during a procedure like a colonoscopy, doctors can use these cool tools like argon plasma coagulation, which uses heated gas to gently seal the tissue and stop the bleeding right there. If that doesn't work, they can use that mesenteric angiography not just to find the bleed, but to actually go in and block it off. And only as an absolute last resort for the really severe cases do they consider surgery.
Now, once that immediate crisis is over and the fire is out, the goal completely shifts. We don't just want to solve this one incident, we want to make sure it doesn't happen again. This is all about long-term management.
For people who have recurring problems, medication can be a really key part of the strategy. There are these drugs called antifibrinolytics, like tranexamic acid, that basically just help the body's natural clotting process work a little better. In some really tough cases, doctors might even try hormonal therapies. But it's important to remember the evidence for that is still a work in progress.
But here's the thing. Treating the bleed itself is only one part of the story. You also have to deal with the aftermath, the consequences of all that blood loss. And this is where supportive care becomes absolutely essential.
That supportive care really comes down to a 1-2 punch. First, you need iron supplements. They're crucial for rebuilding the body's iron stores and fixing the anemia that almost always comes with this condition. And second, if the blood loss was really significant, you might need blood transfusions to quickly get everything back to where it should be.
We've followed the clues, we've run the investigation, and we've laid out the resolution. So I think it's time to officially close the case file with a final look at the key takeaways from our little investigation.
So let's wrap this up. What is it? Fragile blood vessels. How do we find it? With tools like a colonoscopy. And most importantly, how is it managed? Well, there's a clear and effective playbook, from emergency procedures to long-term meds. The bottom line here is that while angiodysplasia is definitely a serious thing, it is absolutely manageable. The mystery is solved.
And that leaves us with one final, pretty important thought. We know this condition mainly affects the elderly, right? And we also know that populations around the world are aging really fast. So mastering how to diagnose and manage angiodysplasia, well, it's not just about solving today's medical mystery, it's about getting ready for a major healthcare challenge of tomorrow.